Our project topic is about malaria from the 2000s to 2017. I'm Feride. I worked with Amy Zura Ising. Malaria is a life-threatening disease caused by infected female mosquitoes. Malaria cases from 2000s to 2017 in terms of global distribution and by regions is what we explored, and as well as the changes in case numbers and death rate.
So our research question is, how has global malaria cases and death cases changed over time and across different regions from 2000 to 2017? Our aims include to visualize the trends in malaria cases and deaths globally, to analyze regional difference and identify patterns or anomalies over time, to better understand where malaria still remains a major public health challenge. Our methodology is that we use dataset from World Health Organization malaria data, and our visualization includes scatter plot, box plot, line graph, chloroplast map to show both the overall trend and regional difference.
So here we show the total reported malaria cases globally from 2000 to 2017. And beginning of the period from 2000 to around 2010, the total number of cases remained relatively stable with only slight increase. However, starting around 2011, we can see a sharp and steady rise in reported malaria cases each year. By 2017, the total number of reported cases had reached over 120 million, which is a significant increase compared to the early 2000s.
Supporting this idea, we wanted to investigate which country had the most impact on these rates. So we did a faceted regions scatter plot, including Africa, Americas, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. As we can see in the scatter plots, there are lots of outliers, Africa being the most prominent one. Here is a line graph supporting this idea that Africa is the main contributor to malaria cases and deaths over all of these regions.
So then we used the Plotly function to do a dynamic chloroplast map showing the change in malaria cases in different countries over time. So the color here represents malaria cases, darker shades indicate more cases. White countries are not included in the study. We can see that most countries are shaded in gray, showing that malaria is concentrated in only a few regions. At the beginning of the timeline, India and Yemen had the highest number of cases, shown in red. However, over time, the situation improved in these countries, and malaria began to concentrate in African nations, and especially the Democratic Republic of Congo and Nigeria. This shift highlights how malaria has become a major public health challenge in Africa recently.
And then now we move on to this map. So this map visualizes the number of reported malaria-related death cases by country from the year 2000 to 2017. Each country is colored on a gradient from light to dark red, where darker shades indicate a higher number of deaths. And again, the countries that are marked as white color mean that they are not included in the data sets. And as the animation progresses through time, we can observe how the burden of malaria shifts across regions, notably countries in African countries like Democratic Republic of Congo and Nigeria constantly show the darkest shades, highlighting their persistent struggle with malaria mortality. This temporal and spatial visualization helps emphasize where intervention efforts has been or still need to be concentrated. This interactive map basically illustrates the global malaria cases and death cases from the year 2000 to 2017. Once again, the countries that are marked as white color mean that they're not included in this data set. And the background color of each country represents the total number of malaria cases using a blue gradient, which means that darker color indicates higher case counts. Overlaying the map, we used rep circles to represent the number of reported death cases. The larger the circle, the higher the death toll. This dual encoded map led us to compare both the prevalence of malaria and its mortality burden at once. For instance, you can see that many Central and Western African countries not only have dark blue shading, which indicate high case numbers, but also large red circles, revealing significant death counts. Meanwhile, other regions may have lighter shades with smaller circles showing lower disease burden. Overall, this visualization helps us to track the geographic and temporal patterns of malaria, highlighting where the disease hits hardest and where public health efforts should be prioritized.
As we conclude, There are several directions for future works. So first, we can explore why malaria trend differs so much between regions. Factors like the healthcare access, climate, and public health interventions. And second, we could add a legend for the death cases in the choropleth map. And the third, since our dataset ends in 2017, it would be important to update it to include more recent years and see if the trends we observe continue. And we could improve the quality of the data by conducting in-case studies on the specific countries. And finally, we could deepen our analysis by looking at the relationship between major malaria interventions and changes in case or death numbers. And that's all for our presentation. Thank you.